Hello, in this episode I'm going to be answering some questions related to breast cancer and health that many of you have asked me, whether that's on this channel or my other social media platforms. So let's dive in. Is breast pain dangerous? No, breast pain is not dangerous at all. As a symptom, I would say it is the commonest symptom I see people present with in clinic. Most women will experience breast pain at some point in their lives, whether you are premenopausal, postmenopausal, young or old, whether the pain is cyclical, or whether it happens with no rhyme or reason. Breast pain does not discriminate, and it can affect all women of all ages at any time. And the nature of the pain can vary quite a lot. It can be sharp and shooting, dull ache, burning sensation, prickly sensation, itchiness, a sensation of swelling, all sorts. The thing is, without the presence of any other symptom, breast pain as a symptom is nothing to worry about. What foods should I eat following breast cancer treatment? Well, there are actually no foods that are forbidden for you to eat following breast cancer treatment. You sometimes hear that there are certain foods that you shouldn't eat, such as soy or sugar, for example. And there are actually a lot of myths out there surrounding what you can and can't eat. And the truth is, you can eat anything you like. And to score brownie points, you should try and eat the rainbow, meaning putting as much color onto your plate. So rather than omitting foodstuffs, you may want to consider adding to the plate herbs, spices, or the colorful stuff. If you eat a healthy diet, you can't really go wrong. Can I exercise through chemotherapy? Yes, you can exercise through chemotherapy. Now, chemotherapy affects people in different ways. Usually immediately after chemotherapy, you may feel a little bit out of sorts. However, after a few days or a week, you hopefully will feel better, and this is the time to do your exercises. Even if it's walking or doing low impact stuff like, just nothing too strenuous, any exercise is better than no exercise. I actually had a patient who did Zumba classes through her chemotherapy treatment, and it's something that she enjoyed immensely. So yes, you can definitely exercise through chemotherapy. Another question I get asked is, I found a breast lump, does it mean it's cancer? And the answer to that is no. If you come to the breast clinic with a lump, you will be examined and likely you will get some scans as well. We may do a biopsy to confirm the nature of the lump. The other thing to remember also is that just because you have had a biopsy, that doesn't mean it's a cancer either. There are so many other possible causes of breast lumps which are non-cancerous. They include cysts, fibroadenomas, scarring, oil cysts, fat necrosis, so not all lumps in the breast are cancerous. By the way, if you are enjoying this episode, I would love you to connect with me on social media. Say hi, let me know what other topics you want me to talk about. Can breast cancer develop whilst you're pregnant? Unfortunately, it can. Breast cancer is the second commonest cause of cancer in pregnant women after cervical cancer, and it occurs between 1 in 1,000 to 1 in 30,000 of all breast cancers. The diagnosis of breast cancer in women who are pregnant can actually be quite challenging, both clinically and radiologically, and this is because of the changes that affect the breast during pregnancy. But the commonest presentation remains a painless lump. The treatment can also be challenging because we have to take into consideration the health of the fetus. And it also needs a multidisciplinary team effort, including an obstetrician. As a breast surgeon, do you operate all the time? Interestingly, I get asked this question quite a lot. And surprisingly, perhaps to some, the answer is no, I don't operate all the time. My workload actually is quite varied. It involves seeing patients in clinics, whether they are new patients or follow-up patients. I give results of surgeries. Unfortunately, I have to break bad news. I discuss treatment options. And not only that, I also teach medical students as well as train junior doctors. So the work of a surgeon is quite varied, and it doesn't involve operating all the time. Where does breast cancer spread to? The first place it will travel to are the glands in the axilla or the armpit, and from there it can spread to other organs of the body. Normally they are the lung, the liver, the brain, and bones. And it sometimes can affect the lining of the abdomen and also spread to the skin. What is the best way to examine your breast? Now, examining your breast is something that is very easily done, and people shouldn't overcomplicate it. Many people worry that they don't know what they're looking for and so don't bother doing it at all. My advice is just to start. You should examine your breast with the flat of your fingers. Don't prod your breast, don't poke your breast. With the flat of your fingers, firstly, you would examine your breast with a light palpation and then repeat it by pressing it slightly deeper. And it doesn't really matter where you start and end, as long as you cover the whole of the breast. Remember to examine the central part of the breast as well as your armpits. And I've actually made a video about how to examine your breast the correct way, and I will leave it in the comment section below. So let me know if this has been helpful in the comment section and whether you would like me to do regular Q&A sessions like this. In the meantime, I'll see you in the next one.